Vitamin D is an essential micronutrient that plays a vital role in maintaining overall health, particularly in the elderly. Its most prominent function is to support the absorption of calcium and phosphate in the intestines, thereby maintaining bone density and preventing osteoporosis, a condition that is very common in older adults, especially postmenopausal women. In addition, vitamin D helps regulate immune system activity, reducing the risk of respiratory infections, seasonal flu, and also contributing to the prevention of chronic diseases, such as type 2 diabetes, cardiovascular disease, and certain types of cancer. Another equally important role is maintaining cognitive function and emotional stability, helping to reduce the risk of depression and memory decline in older individuals. However, many seniors experience vitamin D deficiency without realizing it. The most common cause is the reduced ability to synthesize vitamin D from sunlight due to aging. The skin of older adults produces less vitamin D when exposed to UVB rays. Additionally, habits such as staying indoors, wearing covering clothing, or living in areas with limited sunlight further reduce the opportunity for natural vitamin D synthesis. Declining liver and kidney function in the elderly also disrupts the conversion of vitamin D into its active form. People with chronic conditions such as kidney failure, inflammatory bowel disease, or liver disease, as well as those on long-term use of corticosteroids or anti-seizure medications, are also more susceptible to vitamin D deficiency. To boost vitamin D intake from food, older adults should consume more fatty fish such as salmon, mackerel and sardines, cod liver, eggs, especially yolks, vitamin D-fortified milk and yogurt, fortified breakfast cereals, and naturally sun-exposed mushrooms. In many cases, particularly for seniors living in nursing homes or with limited sunlight exposure, vitamin D supplementation in pill form is necessary under a doctor's guidance to ensure bone and immune health and overall quality of life. Vitamin B12, also known as cobalamin, is one of the most important B-complex vitamins for elderly health, as it plays a key role in red blood cell production, maintaining nervous system function, and DNA synthesis. For older adults, vitamin B12 is particularly essential in preventing megaloblastic anemia, a type of anemia that causes fatigue, pale skin, and long-term weakness. Additionally, vitamin B12 helps protect the myelin sheath surrounding nerves, thereby supporting memory, maintaining concentration, and reducing the risk of cognitive decline or Alzheimer's disease in seniors. A deficiency in vitamin B12 can lead to neurological symptoms such as numbness in the hands and feet, tremors, loss of balance, and even confusion or depression. Alarmingly, B12 deficiency often develops silently and is easily mistaken for normal aging. The most common cause of vitamin B12 deficiency in the elderly is decreased stomach function. Aging can lead to thinning of the stomach lining, reduced hydrochloric acid production, and lower levels of intrinsic factor, making it harder for the body to absorb B12 from food. Chronic conditions such as chronic gastritis, diabetes, Crohn's disease, or having part of the stomach surgically removed can also impair B12 absorption. Furthermore, long-term use of certain medications such as metformin for diabetes, proton pump inhibitors for acid reflux, or antibiotics can reduce B12 levels in the blood. Since the body cannot produce vitamin B12 on its own, and it is only found in animal-based foods, older adults, especially those on a strict vegetarian or vegan diet, need to ensure adequate intake through diet or fortified foods. Foods rich in vitamin B12 include beef liver, chicken liver, red meat, salmon, tuna, clams, oysters, eggs, milk, cheese, and yogurt. Additionally, some breakfast cereals, plant-based milks, and nutritional yeast are fortified with vitamin B12, making them suitable for vegetarians or those with weak digestion. In many cases, especially when deficiency is suspected or confirmed, supplementation through oral tablets or injections under medical supervision is a safe and effective way to prevent the serious consequences of prolonged deficiency. In old age, as the body's metabolic processes become less efficient, the role of vitamin B6 becomes increasingly important and more evident than ever. Also known as pyridoxine, vitamin B6 is not only essential for effective protein and energy metabolism, but also plays a critical role in the production of neurotransmitters such as serotonin, dopamine, and GABA, compounds that directly influence mood, sleep, and memory. In older adults, B6 deficiency may not cause immediate, obvious symptoms, but it can silently impact mental health, increasing the risk of depression, irritability, insomnia, and cognitive decline. In addition, vitamin B6 supports immune function, red blood cell formation, and helps maintain safe homocysteine levels, a factor linked to cardiovascular disease and stroke. B6 deficiency in the elderly is not always due to poor dietary intake. More often, it results from age-related declines in nutrient absorption, impaired liver or kidney function, or long-term use of certain medications such as isoniazid, hydralazine, diuretics, or drugs used to treat Parkinson's disease. Also at risk are older adults with monotonous diets, overly restrictive eating habits, or chronic malabsorption disorders. To naturally increase vitamin B6 intake, seniors should consume more nutrient-rich foods, especially chicken, turkey, tuna, salmon, liver, eggs, legumes such as green beans and soybeans, sunflower seeds, potatoes, bananas, avocados, leafy green vegetables, and whole grains. A diverse and balanced diet, combined with regular micronutrient monitoring through blood tests, can help elderly individuals maintain adequate B6 levels, thereby supporting long-term neurological, mental, and cardiovascular health during the aging process. Vitamin C, also known as ascorbic acid, acts like an invisible shield that protects the body against oxidative agents and disease, a role that becomes especially important in the elderly, whose immune systems are no longer as responsive as in youth. Renowned for its ability to boost immunity, vitamin C is also a powerful antioxidant that helps slow the aging process by protecting cells from damage caused by free radicals, unstable molecules that are a key contributor to chronic diseases such as cardiovascular conditions, cataracts, high blood pressure, and even cancer. Additionally, vitamin C supports the synthesis of collagen, a protein essential for maintaining the elasticity of skin, blood vessels, and joints, which is especially important as aging leads to thinner skin, weaker joints, and slower wound healing. Older adults with a vitamin C deficiency may experience symptoms such as easy bruising, bleeding gums, cracked dry skin, prolonged fatigue, or in more severe cases, subcutaneous bleeding and joint inflammation. Since the body does not store vitamin C, it must be replenished daily. However, many seniors fall short due to diets lacking in fresh fruits and vegetables, overly restrictive eating habits, or simply because weakened teeth make it difficult to chew raw produce. Some also habitually overcook vegetables, which leads to significant loss of vitamin C, since it is highly sensitive to heat. Smoking, alcohol consumption, and long-term use of diuretics are additional factors that deplete the body's vitamin C levels. To address this, older adults should prioritize vitamin C-rich foods such as oranges, tangerines, grapefruit, guava, strawberries, kiwi, ripe mangoes, papaya, pineapple, tomatoes, broccoli, spinach, bell peppers, and kale. Drinking fresh orange juice in the morning, adding raw vegetables to lunch, or incorporating fruit into snacks are simple yet effective ways to boost daily vitamin C intake. When necessary, doctors may recommend supplementation in the form of effervescent tablets or oral capsules to ensure this vital micronutrient is not deficient during the aging process. Not as talked about as vitamin C or as frequently mentioned as vitamin D, vitamin E quietly performs the role of a gatekeeper for the body, guarding against the ravages of time on our cells, especially in older adults. As a powerful fat-soluble antioxidant, vitamin E protects cell membranes from damage caused by free radicals, unstable molecules that accumulate with age and contribute to a host of chronic conditions such as macular degeneration, cataracts, atherosclerosis, dementia, and certain types of cancer. But its role extends far beyond that. Vitamin E also plays a key part in maintaining stable nervous system function, reducing chronic inflammation, and boosting immunity, factors that help older adults ward off arthritis, lingering colds, or persistent fatigue. Although seniors don't have a particularly high requirement for vitamin E, deficiencies still occur, especially as fat absorption decreases with age, and fat is essential for the body to absorb this vitamin. Liver, pancreatic, or intestinal disorders, along with diets too low in healthy fats, are common causes of low vitamin E levels in the blood. Additionally, older individuals who eat poorly, avoid oils due to cholesterol concerns, or rely heavily on processed foods may be lacking in vitamin E without realizing it. Symptoms of deficiency can be vague: muscle weakness, fatigue, slowed reflexes, balance issues, or vision disturbances, all of which are easily mistaken for just getting old. To prevent this, older adults should include vitamin E-rich foods in their daily diet, such as vegetable oils, especially sunflower, canola, and olive oil, almonds, pistachios, sunflower seeds, peanuts, avocados, spinach, kale, pumpkin, tomatoes, and salmon. There is often no need for supplements if the diet is well balanced and includes sufficient healthy fats and fresh produce. Vitamin E not only helps slow physical aging, but also preserves a sense of vitality, flexibility, and mental clarity in old age. A seemingly small benefit that carries great weight in the journey to a healthy and joyful aging. Not as prominent as vitamin C, nor as widely mentioned as vitamin D, vitamin K is often overlooked on the list of essential micronutrients. Yet for older adults, its quiet presence is a crucial factor in maintaining blood and bone health. Two pillars of resilience during the aging process. Vitamin K plays a central role in activating proteins that are responsible for blood clotting. Thanks to it, wounds, whether minor or serious, can be handled efficiently, reducing the risk of prolonged bleeding or unusual bruising, symptoms often downplayed in the elderly. But vitamin K's importance goes beyond blood. It's closely linked to bone health. It activates a protein called osteocalcine, which is essential for binding calcium to bone tissue, thereby maintaining bone density and lowering the risk of fractures in older adults. Numerous studies have shown that seniors with low levels of vitamin K face a higher risk of osteoporosis, hip fractures, and even arterial calcification. The causes of vitamin K deficiency in the elderly are varied. Diets lacking in green vegetables, digestive disorders that impair absorption, or long-term use of blood thinners like warfarin, broad-spectrum antibiotics, or cholesterol-lowering medications. Liver disease or bile duct obstruction can also interfere with the absorption of vitamin K, since it is a fat-soluble vitamin. Deficiency symptoms are often subtle, but, if prolonged, may result in nosebleeds, bleeding gums, spontaneous bruising, or gastrointestinal bleeding. To naturally support their health, seniors should prioritize vitamin K-rich foods such as spinach, kale, broccoli, lettuce, mustard greens, cabbage, cucumbers with skin, fermented soybeans, natto, eggs, liver, and dairy products. When green leafy vegetables are a regular part of the diet, the risk of vitamin K deficiency can be significantly reduced, helping to ensure strong bones, stable blood clotting, and smooth overall functioning. A solid foundation for healthy aging in later life. Vitamin A has long been known as an essential nutrient for vision, but its role in the health of older adults extends far beyond just the eyes. Among seniors, vision decline is one of the most visible signs of aging, and vitamin A is a key factor in preventing age-related macular degeneration, one of the leading causes of irreversible blindness in the elderly. Vitamin A is directly involved in the formation of retinal pigments, supports the ability to see in low-light conditions, and protects the cornea and other sensitive eye tissues from damage. However, this is just one part of its wide-ranging benefits. Vitamin A also plays a crucial role in strengthening the immune system, helping the body fight off infections, something especially vital as aging weakens the body's natural defenses. Moreover, vitamin A helps maintain the integrity of the skin and mucous membranes in the respiratory, digestive, and urinary tracts, creating a protective barrier against bacteria and viruses. Vitamin A deficiency in the elderly often develops silently, but can lead to serious consequences such as dry eyes, night blindness, recurring infections, rough or dry skin, and weakened immunity. Common causes of deficiency include poor dietary intake, fat malabsorption disorders from liver, pancreatic, or intestinal diseases, or long-term use of medications that impair vitamin metabolism. Strict vegetarians or individuals following unbalanced diets may also be at risk. To prevent deficiency, seniors should increase their intake of vitamin A from natural sources like animal liver, chicken or beef liver, egg yolks, whole milk and dairy products, and cod liver oil. Additionally, colorful fruits and vegetables rich in beta-carotene, a precursor to vitamin A, are excellent dietary sources. These include carrots, pumpkin, sweet potatoes, tomatoes, mangoes, papayas, amaranth leaves, spinach, and kale. A varied, well-balanced diet will not only help older adults maintain good vision, but also enhance overall health and reduce the risk of age-related illnesses.